Kidney stones. The medical term for the condition of having kidney stones is nephrolithiasis. Nephro refers to the kidneys, and lithiasis refers to the formation or presence of calculi, stones, in the urinary system. Therefore, nephrolithiasis specifically refers to the presence of stones in the kidneys. Symptoms commonly associated with kidney stones. 1. Severe and sudden pain in the back, side, lower abdomen, or groin. 2. Waves of intense pain, often referred to as renal colic. 3. Hematuria, blood in the urine, which may cause urine to appear pink, red, or brown. 4. Frequent urination and a sense of urgency to urinate. 5. Painful urination. 6. Cloudy or foul-smelling urine. 7. Nausea and vomiting. 8. Fever and chills, indicating possible infection. 9. Difficulty finding a comfortable position due to the pain. 10. Pain that radiates to the lower abdomen and groin area. 11. Pain that fluctuates in intensity as the stone moves through the urinary tract. 12. Persistent need to urinate even after emptying the bladder. 13. Painful flank. In addition to the back and abdomen, the pain caused by kidney stones can also be felt in the flank region, which is the area between the ribs and the hip. 14. Painful groin. The pain from kidney stones can radiate to the groin area, causing discomfort and pain in that region. 15. Painful testicles or labia. In some cases, the pain may extend to the testicles in men or the labia in women. 16. Urinary incontinence. In some instances, kidney stones can cause temporary loss of bladder control, leading to involuntary leakage of urine. 17. Urinary tract infection, UTI. Kidney stones can increase the risk of developing a urinary tract infection. Symptoms of a UTI include a strong, persistent urge to urinate, a burning sensation during urination, cloudy or foul-smelling urine, and fever. 18. Abdominal bloating or distension. Large kidney stones or a blockage in the urinary tract can cause abdominal bloating or distension. 1. Calcium stones. These are the most common ones. Even just eating some foods very high in oxalates, such as rhubarb, or taking unusually high levels of vitamin D, can boost your chances of getting this type. You could get this kind if you typically don't drink enough water or if you sweat a lot and don't replace the fluids you lose. 2. Cystine stones. This is the least common type and is due to a genetic mutation. In this situation, your kidneys have trouble reabsorbing a compound called cystine, which ends up in the urine at higher levels and causes stones to form. 3. Struvite stones. Infections, especially in the urinary tract, can cause this kind of stone. 4. Uric acid stones. Eating large amounts of animal proteins can lead to uric acid buildup in your urine. That can eventually form a stone either with or without calcium. Risk factors include gout, diabetes, and chronic diarrhea. Diagnosis by getting the medical history, examination of the patient, and ordering tests to get X-rays, pictures of the kidneys and urinary tract. Also possible are 1. Blood tests, to determine if you have too much calcium or uric acid in your blood. They also tell a lot about how healthy your kidneys are. 2. Urine test. For this test, there is a need to collect 1 or 2 24-hour samples. It shows if there are too many stone-forming minerals in the urine or not enough other compounds that stop stones from forming. 3. Imaging tests, to check for stones in your urinary tract. The patient might get an X-ray of the belly or a computerized tomography, CORT, scan, which combines a series of X-rays to make a picture of the body. An X-ray can show larger stones, but a CT scan helps doctors find small ones. 4. Analysis of past stones. The patient is asked to pee through a strainer to catch any stones that might pass. The lab determines what the stones are made of. This can also tell what's causing the stones and how to treat them. 4. Pregnant women get an ultrasound rather than a CT scan in the first trimester when babies are most at risk of a radiation injury. A low-dose CT scan is less dangerous in the second and third trimesters. It's important to note that the presence and severity of symptoms can vary depending on factors such as the size, location, and number of kidney stones, as well as individual differences in pain tolerance. If you suspect you have kidney stones or are experiencing any of these symptoms, it is advisable to consult a healthcare professional for a proper diagnosis and appropriate treatment. Thank you for joining us in exploring the topic of kidney stones. We hope that the information provided has been helpful and informative. If you found this discussion valuable, we encourage you to subscribe to our channel or newsletter to stay updated on future content related to health, wellness, and various other subjects.